Hello, everybody, and welcome back. My name is Jonathan, and I will be the facilitator for this session. And as usual, we have a few announcements before we start. So I thank you all for arriving on time. And also, please remember that it's important to stay the full hour and also to participate in order to receive credit. Any of you may choose to only be an observer. However, if you only observe, it will not count as a credit. If you would like to be an observer, please let me know. If possible, to raise your hand right now. There's the little electronic hand down below. If you want to just observe, and that way I can take notes. Okay, so Dilcia, you would like to just observe today, so good. And welcome to meet you. I'm assuming it's your first session here. Good. So I will assume that everybody else will be participating. Okay, good. So I will be typing, please make sure that your chat boxes are open. There's the little chat button down below. And I'll be typing in the names of the scenarios. You'll need to register those in order to complete the assignment afterwards. And I can also put in any relevant medical terms, any words that you might need to look up. And I also encourage all of you to use the chat box freely in order to give any feedback, if there's any encouragement you'd like to give, if there's any suggestions or anything you think would be helpful or interesting to the rest of us, please feel free to use the chat box throughout the session. Hold on just 1 minute. I see Anna writing she can't hear anything. Can everybody else hear me okay? Yes, okay, thank you. Let me see, let me try asking her to refresh her screen. 1 moment, please. Give me just 1 second, make sure she can hear okay. So hopefully, and just for anyone else, if you ever have any problems with hearing or with your microphone, remember to just refresh the screen, and that usually fixes any problems like that. Good. So back to the announcements. Please make sure that you're muted until I call on your name. And if any of you have any questions, please wait until the end of the session once everybody's had a chance to go, and we can open up for questions and answers if you have any questions about interpreting or about anything that was said in this lesson today. If you have any technical questions or questions about the course, about assignments, then Dr. Lee would be happy to answer those questions for you. She has question and answer sessions twice a week, and you can see those when they take place. They're registered there on the community board, so feel free to log into those, her office hours, anytime you have any questions about the course or assignments. Now, in order to develop good skills, it's important for everyone to be in the habit of practicing on our own. And that's something that even experienced interpreters do. Similar to musicians, even at a professional level, they continue to practice. So as interpreters, that's kind of the mentality we need to have, be constantly practicing to make sure we can keep up on the lesser used vocabulary or any new vocabulary that we need to still learn. A great way to practice is doing sight translation, and a really good website, one that Dr. Lee likes to recommend, is webmd.com. Put that in the chat box for you. They have authority articles on numerous medical subjects. So a good way to use that site, for example, would be to choose an article that interests you and then try to sight translate it. So you look at it in English and read it out loud in your target language. And as you do that, make sure you have a medical dictionary handy and that you can look up any words you're not familiar with. That will help you not only to help you with your vocabulary, but it'll also make you quicker at looking words up. So when we do need to look a word up on a job, we need to be as quick as possible with it. So it's good to get some practice with that as well. If any of you don't have a medical dictionary, bilingual medical dictionary yet, here's a link to one that you can use online that works out really good, lingui.com. It's nice because it gives you the context. It shows you the way it was translated in written translations, so you can make sure you have the right word. Generally, it's better to stay away from Google Translate or anything like that because they just give you word for word, and many times they're not accurate. So a site like this one here is better because you can double check the context. Another really good website to practice with for those of you who speak Spanish is this one here, docmali.com. They have some really good podcasts and just some really good information, specifically for those who work in the medical field using Spanish and English. Now, it's also important to have a notebook and to learn how to take brief notes that will help you while you're interpreting. So, especially, for example, if you hear a list, it's very easy to leave something out from a list, or it's very easy to get numbers backwards or confused, especially if there's multiple numbers in an utterance. So be ready to write down any numbers you hear, and if there's a list, then practice writing lists quickly, and just practice taking basic notes using any abbreviations or symbols that you might want to use, but that does take some practice to get used to. So please, during the session, especially while it's others' turn, it's a good time to practice your note taking. And when it is your turn, please remember to refer to yourself in the third person. And that's standard protocol for medical interpreters. It helps avoid confusion, and it makes it obvious that you're not interpreting, but that you're requesting something. So, for example, instead of saying, "Could you please repeat that?" If you need something repeated, you would refer to yourself as the interpreter and say something like, "The interpreter needs repetition." Or the interpreter needs clarification, and then explain what you need clarified. So remember to practice that as well. It does take some getting used to. So, and of course, for those of you who would like to have a private session with a facilitator, maybe if you want to expedite the process, or if you just want some personalized help, here's a link right here where there's some more information for how you could schedule one of those. And those are paid sessions, but you'd get a 30-minute or hour session one-on-one with a facilitator. So if that's something that interests you, there's some information there. Good. As you probably noticed, this session is being recorded. We do record one session a month just for quality assurance purposes. So let me see if anybody logged in during the announcements. I believe we're still the same. Good. So we do have one observer, and that means we'll have about 6 minutes each to practice. So that's a good amount of time. And we'll go in the order that you guys logged in on. We can start with Sandra. Hello, Sandra. How are you?
Hi, Jonathan. Good morning.
Okay, good morning. And welcome back.
Thank you.
All right, you're welcome. Let me see. The first one that we will go over here, I'll put in the chat box the first scenario. This one's called the red eye. So, good afternoon. I understand that your left eye is bothering you.
Buenas tardes. Entiendo que su ojo le está molestando.
Okay, good. But there was
Right eye, right?
okay, the other side. So,
Okay.
if you're ever not sure, then that's where you would ask for repetition. Or I would suggest in this case saying the interpreter requires repetition or clarification. I'm sorry. Was that the right eye or left eye?
Okay.
And then they would tell you. So, but that's a much better way to do it than to just guess and get it wrong. So,
Okay. Okay.
all right. Sí, se me puso rojo esta mañana y me duele mucho.
Yeah, this morning I had a red eye and it hurts a lot.
And have you noticed any secretion from the eye?
¿Y ha notado alguna secreción del ojo?
And also, when did the pain begin?
Y también cuando inició el dolor.
Bueno, me desperté con un poco de dolor y está aumentando cada vez.
Well, I woke up with a little bit of pain and it's getting worse.
Y también tiene bastante secreción.
And it has a lot of secretions.
Did the pain come on suddenly then?
¿El dolor apareció de repente?
Sí, doctor. No tuve ninguna molestia del ojo ayer.
Yeah, doctor. I didn't have any bothers yesterday from my eye.
Okay. Yeah, that's a word that sometimes is a little bit strange to interpret. Can you think of a better word maybe than saying, because any bothers, it doesn't really sound right in English.
Okay.
Is there anything else? Or if anybody wants to give suggestions to in the chat box, feel free. Good.
Um,
Discomfort. That would be a perfect word to use.
Okay.
Okay. So maybe take note of that and remember. If you practice
Right.
it a couple times, it'll come natural. So.
Can I say inconvenience too or not?
No, that doesn't really fit in the context.
Okay.
In a different context, that would work good, but in this
All right.
context, it's discomfort would be, I think, the perfect word to
All
use
right.
there. So,
All right.
all right.
Thank you, Lina.
Okay, so have you had any trauma to your eye?
¿Usted se ha golpeado el ojo en su ojo
Or has something fallen inside it?
o se le ha metido algo dentro?
Creo que no.
I don't think so.
Have you ever had this problem with your eye before?
¿Usted ha tenido este problema en su ojo antes?
Bueno, fui operado del ojo derecho una vez hace 5 años.
Well, I had a surgery on my right eye 5 years ago.
Okay, I see that here in your medical history.
Sí, así lo veo en su expediente.
Now, do you use contact lenses?
¿Usted usa lentes de contacto?
No, no los uso.
No, I don't use them.
And does it hurt you to open your eye?
¿Y le duele cuando abre su ojo?
Pues me duele al abrir el ojo cuando hay luz fuerte.
Well, it hurts when I open my eye when the light is bright.
Si no hay mucha luz, puedo abrirlo bien.
If there's not so much light, I can open very, very well.
And are you nauseated and vomiting?
¿Tiene náuseas o vómitos?
Sí, tengo náusea por el dolor, doctor.
Yeah, I have nausea because of the pain, doctor,
Pero no he vomitado.
but I haven't vomited.
And how is your vision? Can you see okay?
¿Y cómo está su visión? ¿Puede ver bien?
Veo círculos alrededor de la luz y mi visión está borrosa.
I see circles around my vision. And interpret the repetition of the last part.
Sure. I'll give you the full sentence here. There's a little detail
Okay.
also before that. Veo círculos alrededor de la luz
Okay.
y mi visión está borrosa.
Mhm. I see circles around the light and my vision is blurred.
Okay. All right. Good job, Sandra.
Thank you, Janet.
All right. You're welcome. And let me see. Next, we have Anna. And Anna, I'm not sure. Is this your first session?
Yes.
Okay. All right. Well, welcome to meet you.
Thank you.
You're welcome. So I think you can kind of see the way this works. Are you ready to give it a try, or do you want to wait a couple more?
I would like to wait a couple more.
Okay, sure, no problem. We'll come back to you
Okay.
afterwards then. What was your target language?
Spanish.
Spanish. Okay, good. All right, so we can continue then. Next to log in was Florence. Hello, Florence. How are you?
Hi.
Hi, good morning. All right, so we can continue here, and today we have enough time where we can do sight translation also with everybody whose language I don't speak. So we can start out with the scenario, and then we can finish with some sight translation, so you can go into English. All right, but back to the scenario here. Now the doctor asks, "Can you tell me how many fingers I'm holding up?" And Florence, oh, there you are. Okay, go ahead.
Yeah, I'm here.
Okay.
Jonathan.
Okay, so can you tell me how many fingers I am holding up?
Ushobora kumbwira intoki zingahe mfashe nonaha?
It looks like 2, doctor, but I'm not sure.
Biragaragara nkaho ari ebyiri muganga ariko ntabwo mbyizeye neza
It's that everything is blurry.
kubera ko byose ndabona ari ibicu.
Okay, I'm going to examine your eyes now.
Reka nkukorere ibipimo by'amaso.
Take a seat here.
Icara aha ngaha.
Now put your chin here and look forward. Okay, I think we lost you, Florence. I can see your microphone is still on, but I can't hear anything.
Can you hear me now?
Okay, yes, I can hear you now. All right, so the doctor said, put your chin here and look forward.
Umuganga aravuze ngo shyira akananwa hano hanyuma urebe imbere.
And try not to move your eyes.
Gerageza ntunyeganyeze amaso.
I'm going to do a test for glaucoma.
Ngiye gukora ikizame cya glaucoma.
Please keep your eyes open.
Gerageza ufungure amaso.
Now, it appears that the pressure of the liquid in your eye has gone up.
Biragaragara yuko umuvuduko w'amarira mu maso yawe uri kuboneka.
And this is what's causing these discomforts.
Niyo mpamvu biri kukubuza amahoro.
So we have to treat you immediately.
Ni ngombwa ko tukuvura aka kanya.
First, I'm going to put these drops in your eyes.
Icya mbere ngiye kugushyira uyu muti w'amazi mu maso.
And then I'm going to give you 2 pills to lower the pressure. Okay, can you hear me okay, Florence?
You want to go this way or you want to go this way? You want to go through here? Do you want to go this way or that way? Come on.
Okay, are you ready to continue?
I'm sorry, Jonathan. Yes,
Sure,
I'm
no
done.
problem, no problem.
Sorry.
Okay, no problem.
Can you repeat, please?
Sure. It sounds like you have quite a bit of distractions there, so no problem. Now the doctor continued, and then I am going to give you 2 pills to lower the pressure.
Hanyuma ndaguha ibinini bibiri kugira ngo bigabanye ububabare.
And then I am going to refer you to the ophthalmologist in order that she can see you today.
Hanyuma ndagukorera ubuvugizi bwo kugira ngo ujye ku wundi muganga ndenze akubone uyu munsi.
Okay, that all sounded good. Give me just a minute. I can open up. No problem. Let me give you something to say, translate. Give me one moment, please. Okay, so before we had been working on an informational brochure that talked about talking to children about the flu. So I can give you, I'll put in the chat box the next paragraph. So you can say translate that. Okay, so can you see that all right?
Okay, yes.
Okay, good. So take a look, and whenever you're ready, go ahead.
Okay, the time they feel sick, told them to stay in the house, don't go to work, or to go to school. And then don't be very closer to others. Until they're getting better.
Okay, perfect. Let me give you one more here.
They must take the shot and to eat very healthy, to sleep enough time, and to do more exercise.
Okay, very good. Now, the very first part, I didn't quite catch what you said for the introduction. Could you repeat that? Before healthy eating?
Is it the first paragraph at the beginning?
Yes, the first couple of words there.
I don't get it. It's meaning like two things, but I don't know exactly which one.
Okay, sure, sure.
It looks like
I'll-
to get shot, and then another way to say to cover themselves.
Okay, let me give you the full paragraph in English, what I have here, and see if that makes sense to you. So then you can look at that afterwards. But yes, so it was just the first few words that were a little bit off. Everything else was perfect. So, but good job, Florence.
Thank you.
All right, you're welcome. Good. So let me see. Continuing. Now we have Samar. Hello, Samar. How are you?
Hello, Jonathan.
Oh.
Hello, all.
Okay. All right. So yes, let me see. We can continue here then, and we can do a scenario and then some site translation.
Okay.
So we're going to start a new scenario now, and this one will be on a car accident. So it will be with interpreting for paramedics.
Okay.
Ma'am, what is your name?
مدام شو اسمك؟
My name is Kathy.
اسمي كاتي.
And how old are you, Kathy?
وقد إيه عمرك يا كاتي؟
I'm 45 years old.
عمري 45 سنة.
Do you know where you are?
تعرفي وين أنت؟
Yes, I'm across from Target.
بعرف أنا قبال تارجت.
And can you tell me what year we're in?
وفيك تقولي لي أي سنة نحن؟
It's 2024.
2024.
Do you remember what happened?
بتتذكري شو صار معك؟
Well, I was driving when a car appeared in front of me and it hit me.
كنت عم سوق وقت السيارة طلعت قدامي وضربتني.
I don't remember anything else.
وما بتذكر شي تاني.
Do you know how fast you were going?
بتعرفي قد إيه كانت سرعتك؟
I was going about 30.
بتصور كنت ماشي 30.
And it seemed like the other car came at full speed.
والسيارة تانية اجت بسرعة بكامل سرعتها.
And are you having trouble breathing?
عندك أي مشكلة بالتنفس؟
Yes, my chest hurts a little bit when I breathe.
إيه صدري عم يوجعني وقتها بتنفس.
Okay, I'm going to listen to your lungs.
أوكي رح أتسمع على روايك.
So breathe deeply through your mouth.
تنفسي بعمق من تمك.
And now exhale through your mouth.
وزفير من تمك.
Now, are you in pain?
في أي وجع؟
Yes.
نعم.
And where does it hurt the most?
وين أكتر شي عم يوجعك؟
My head in the front on the right side.
راسي من قدام على جهة اليمين.
And does your neck hurt?
ورقبتك عم توجعك؟
Yes, on the right side also.
نعم على الجهة اليمين كمان.
Now, from 1 to 10, 10 being the worst pain, how much does it hurt?
هلا إذا بدنا نقول من 1 ل10، 10 الوجع الرهيب، قد إيه أنت عم توجعي؟
I don't know, but it hurts a lot.
ما بعرف بس بعرف إنه موجوعة كتير.
Okay, good. Give me just a second here to open up something here to site translate.
Okay.
And okay, there it is. So we had started one on an exercise program. And let's see, this is where we had left off. So give me just a second. Hopefully this is going to copy or paste correctly. All right, there you go.
Okay, it's a very small letter, so I'm gonna take my time.
Okay, sure.
The goal of the exercise is to do it from 4 to 6 days weekly. Do the exercise from 30 to 60 minutes each time in order to prevent any injury. Then add the days and the time to do the exercise slowly.
Okay, good. All right, perfect. Let me give you also for your notes, I can give you what was written in English just to help you out there, but you had everything very good. The one thing that was more comfortable, the way they put it, they put slowly increase.
Okay.
But the rest, the way you said it, though, was understandable. And that was good.
Okay.
So,
Okay.
all right. So now the next subtitle here, or the next section of it, is here.
Jonathan, can you put more because it's like a beginning only?
Okay,
Like
yes, this is an introduction. So
Okay,
they
okay.
have this, and then they have like 5 bullet points.
No problem. So
I'll give you the next bullet point though, if that helps. So
the daily exercise help in the way the heart and the lungs works.
okay, good. And here.
Keep the healthy weight or help on losing weight.
Okay, actually, let me try to give you the next 3. Hopefully
Yeah,
that'll
together better.
paste
Yeah.
correctly. So there
Yeah.
you go. Okay.
Okay. Help your balance, strengthen your muscles, and make your muscles get rid of all the tension, the pressure, and keep your mood up. Lessen the danger of having any heart problem or high blood pressure, or okay. Interpreter need to look one.
Sure. We're went a little bit over time, so I'll give you that last one here.
I know
In English,
diabetes, but also
so you can
osteoporosis. Yeah,
osteoporosis.
I know
All right.
diabetes, but
Okay.
osteoporosis. Thank you.
All right, you're welcome, and good job, Savan.
Thank you.
All right, you're welcome. So let me see. Continuing, now we have Shumei. Hello, Shumei. How are you?
Good morning, Jonathan.
Okay. Good morning. All right. Let me pull my notes back up. 1 second. Okay. So now we're back to the scenario, and now the doctor said, or the paramedic says, "I need to take your temperature."
我需要量你的体温。
This thermometer goes under your tongue, so please open your mouth.
这个体温计是放在你的舌头底下，请你打开你的嘴巴。
And now I'm going to press on your chest, your stomach, and your pelvis.
我现在会施点压力在你的肚子，还有骨盆。
That doesn't hurt at all.
一点都不痛。
What really hurts is my head.
真正让我痛的地方是头部。
And what happened to my face? I'm bleeding.
我脸怎么了？它好像在流血。
Oh, it's okay, ma'am. I'm going to examine your face.
那是没问题的。我现在要检查一下你的脸。
And all I see are some scratches, so it's okay.
我看到的就是一些擦伤，没问题的。
Can you feel when I touch your foot?
你可以有感觉吗？当我触摸你的脚。
Yes, I can feel that.
是的，我可以感觉到。
Can you move your toes?
你可以动你的指头吗？
Okay, very good. Now we're going to turn you over and check your back.
好，非常好。那我们现在把你转过来，我来检查一下你的背部。
It's important that you don't move.
是非常重要，请你不要动。
And I'm going to press on your back and tell me if it hurts.
我会压一下你的背部，告诉我如果会痛。
And does it hurt here?
这里会痛吗？
No, that doesn't hurt.
不会痛。
Okay, good. Now I'm going to ask you questions about your medical history.
好，我现在要问一下你的病历史。
Do you have allergies to any medicines?
你有对任何药物过敏吗？
Yes, I'm allergic to codeine.
是的，我对可待因有过敏。
And are you taking any medications?
你现在有吃任何药吗？
Yes, I take some medications for blood pressure.
是的，我有吃血压的药。
And aside from high blood pressure, do you have any other medical problems?
除了高血压以外，你还有其他问题吗？
Okay, that sounded good. Let me give you something to sight translate, and let me see. We were doing a brochure on choosing a healthcare provider for your baby, and we're towards the end of it. So let me give you the next bullet point here. Just a minute. Okay, send that. So whenever you're ready.
OK。Please consult with your healthcare provider and confirm with your friends and relatives. If you need to check the healthcare provider list in your neighborhood, you can call the local hospitals referring hotline or ask or check other website. You can also get a list of provider from the insurance company provided.
Okay, good. That was good. You put provider twice. So here in English, they just put that at the end. So they call it your health insurance provider. So I think that's what was confusing you there. But good job, though. That was good. You included everything. Go ahead.
Try to get a list of provider or list of what?
Okay, so a list of providers, right? So because because we are starting at the end of the brochure, so it can be confusing. And it's been a while since we've done this, but the whole brochure was about choosing a healthcare provider for your baby. So by choosing a doctor, a pediatrician. So yeah, so that's what they're referring to, a list of pediatricians in the area. But yes, you're right. Without context, I can see that would be confusing. So, all right, but good job, Shumei. And good. So let me see. We can continue now. And next we have Luis. So hello, Luis. How you doing?
Hi. Good morning, Jonathan.
Good morning. All right. Let's go back to the scenario before. Back to the paramedics. Give me just a second to pull that up. All right. So the doctor had just asked about or the paramedic had just asked about other medical problems. And she answers, cuando era niña tenía asma.
When I was a kid, I had asthma.
Pero hace mucho que no uso inhalador.
But it's been a while since I used an interpreter needs repetition.
Okay, sure. You almost had it, but un inhalador.
but it's been a while since I used an inhaler.
Perfect. And when was the last time that you ate?
¿Cuándo fue la última vez que comió?
Comí el desayuno, comí unos pancakes.
I ate at breakfast. I had some pancakes.
And is there someone who we should contact for you?
¿Hay alguien que gustarías que contactáramos por ti?
Sí, mi esposo.
Yes, my husband.
Su número de celular está en mi cartera.
His phone number is in my wallet.
Okay, we're going to put you in the ambulance and we're going to take you to the hospital now. And I think I might have lost you there. Can you hear me okay, Luis?
Yes, I'm sorry. My phone turned off on me.
Oh,
Yeah.
okay, no problem.
Interpret needs repetition.
Sure. Okay, we're going to put you in the ambulance and we're going to take you to the hospital.
Bien, te vamos a poner en la ambulancia y te vamos a llevar al hospital.
Okay, so that was all very good, except you forgot to use the usted form, the formal form of speaking. So yeah, remember that. I know that's not always easy, but it's always definitely, it's expected to default to the formal form. Of course, unless we have a little kid that we're talking to. So, all right. So continuing now, let me see here. Now we have one on, it's a phone call, so a clinic receptionist. That will be the next scenario. Let me put that in the chat box. Okay, so good morning, St. Mary's Clinic.
Buenos días, St. Mary, Clínicas St. Mary's.
This is Richard. How can I help you?
Soy Richard. ¿Cómo puedo ayudarte?
Es que tengo un problema y necesito ver la doctora Anderson.
I have a problem and I need to see Dr. Anderson.
Of course. What's your name?
Está bien. ¿Cuál es tu nombre? ¿Cuál es su nombre?
Okay, good. Perfect. Me llamo Daniel Ortiz.
My name is Daniel Ortiz.
And could you spell your last name, please?
¿Pudieras deletrear tu último nombre, por favor?
Sí, O-R-T-I-Z.
Yes, O-R-T-I-Z.
Good. And what is your date of birth?
¿Cuál es su fecha de nacimiento?
Es el 5 de mayo de 1970.
May 5th, 1970.
Good. I see you right here.
Bien, lo miro aquí.
Okay. All right, good. And just as a side note here, sometimes when spelling names, it can be very hard. Ortiz is a pretty easy name to understand over the phone, but like when you have M's and N's and V's and B's and D's, it can be very confusing. So, and this is a little bit directed to everybody, but I'll also ask you, Luis, are you familiar with what they call the NATO alphabet? So where the way to spell words out? So like you would say O from Oscar, R from Romeo.
Yes.
Yes. Okay. That's something that's good to be familiar with. In English, it's usually, there's different things you could use. Some people, for example, they'll use different words, but there's the NATO alphabet, they call it. So NATO. And it was made to use for communication over radios to be able to spell words out. But it's definitely good. I actually have a copy of that I keep on my desktop. I keep one in English, but also one in Spanish and one in Italian, because each language usually uses different words. So in Spanish, they're not that familiar usually with the NATO alphabet. I find most of the patients or people on the phone are not familiar with it. So like you would say, well, O de Oscar is good, but like R de Roma, T de Tierra, and just find words that are comfortable to use for that. But just as a side note and a suggestion for everybody, try to get familiar with that, because especially if you're working with medical insurance or mostly that, they'll almost always start out with names and addresses and stuff like that. So, all right. So let's continue here. So now I would like to confirm your address.
Me gustaría confirmar su dirección.
We have 1300 3rd Street in Minneapolis.
Tengo 1300 calle 3 en Minneapolis.
And the zip code 55418.
Y el código postal 55. Interpreter needs repetition of zip code.
Sure, 55418.
55418.
Okay, is that correct?
¿Eso es correcto?
Okay, good job, Luis.
Thank you, Jonathan.
All right, you're welcome. And let me see. So next we have Michaela. Hello, Michaela. Chivach.
Bună ziua!
That's about all I remember from my Romanian. So.
Yeah.
But all right, good to see you. All right, so are you going to be doing Spanish today?
Yes, Spanish.
Okay, good. So we'll continue here. So he just they just asked if the address was correct, and he answers, no, no es correcto.
No, that's not correct.
Me he mudado a 1459 Kennedy Street.
I moved at 1459 Kennedy Street.
Okay, and what is the zip code?
Bueno, ¿y cuál es el codo? No sé si es zip code.
Okay,
El código postal.
good. Es 55,419.
It is 55. Interpreting repetition.
Sure. 55,419.
55,429.
Okay. So 419.
419.
Okay,
Sorry.
good. No problem. It does get confusing, and this is a side note as well, because in different languages they'll put numbers together differently sometimes, and a lot of times just from country to country it might vary the way they'll put the numbers together.
Mm-hmm.
So again, if there's ever a need for repetition, sometimes it can be confusing. So what I'll usually do is just tell the doctor that whoever's on the other line, interpreter requires clarification, and then I'll say it number for number to them. Like for example, disculpa, usted ha dicho 554 y después, and then they'll say 19.
Okay.
So if there's ever any confusion, make sure you can clarify it. But numbers can get confusing sometimes. So.
Gotcha. Mm-hmm.
All right. What is the best phone number to contact you?
¿Cuál es el mejor número de teléfono que podemos contactarte?
Es mejor llamarme a mi móvil.
It's better to call me on my mobile.
El número es 608-555-0183.
608. Interpreting clarification.
Okay. Okay, so you say that, and then because you would be clarifying from the patient, right? So then you would have to ask the patient the question.
¿Cuál es el número otra vez?
Okay. 608
Sí.
555
Sí.
01
Sí.
83.
Okay. So the number is 608-555-0183.
Good. Okay, please wait one moment and I'll transfer you to Dr. Anderson.
Bueno, por favor, espera un momento y te voy a transferir al Dr. Anderson.
I'm sorry, but the extension for Dr. Anderson's nurse is busy.
Lo siento, pero la extensión por Dr. Anderson está ocupada.
Would you like to leave a message?
Quisiera dejar un mensaje.
And she will return your call shortly.
Y ella puede volverse su llamada en corto tiempo.
Sí, está bien.
Yes, that's fine.
Okay, I will transfer you to her voicemail for you to leave a message.
Bueno, te transferiría a su mensaje de voz para dejar un mensaje.
Okay, good. All right, so let me see. Okay, good. Good job, Michaela.
Thank you.
You're welcome. And next we have Linda Vertusco. Hello, Linda. How are you?
Hi,
Hi. And is this your first session with
this is
PTO?
my yes, this is my
Okay.
first one.
All right. Well, welcome. And
Thank you.
I think you've had enough time to observe to get figured out how it works, right?
Yes.
Okay, good. So now we can continue with this scenario here. And so they left a message, and now the nurse is calling him back. And so, hello, Daniel. I'm returning your message.
Hola, Daniel, estoy regresando la llamada.
How can I help you?
¿Cómo le puedo ayudar?
Tengo una pregunta sobre el medicamento que me recetó la doctora Anderson.
I have a question about the prescription that I was given by Dr. Anderson.
Vi a la doctora hace 2 días
I saw the doctor 2 days ago,
y me recetó un medicamento para la presión.
and I was given a medication for my blood pressure.
Y creo que me está provocando mareos.
And I think it's making me dizzy.
I see. I'm sorry to hear that.
Perdón de escuchar eso.
Do you have any other symptoms like nausea and vomiting?
¿Tiene algún otro, I'm going to look up a word.
Sure.
¿Tiene algún otro síntoma, náusea o vómito?
Okay, good. So when you look up a word, if you're on a job, it's if you need time. Sometimes you can look it up maybe as you're interpreting the rest. It takes some practice, but sometimes you can leave that word for the last and try to look it up. But then, if you get to a point where you need to look a word up, then you would speak in third person. You would tell the doctor the interpreter requires a moment to look up a word, or something
Gotcha.
like that. Okay.
Gotcha.
And
Thank you.
all right, you're welcome. But with some practice, sometimes you can leave that word to the end as you're looking it up as you're speaking. So, but yes, when we do have to look up a word, no problem. We just need to be as quick as we can about it. So, all right. Now she answers, me siento más o menos bien,
I feel so.
salvo una leve sensación de mareos.
I have a mild dizziness.
And do you feel like you're going to faint?
¿Siente que se va a desmayar?
And have you been able to take your pulse or blood pressure today?
¿Se ha podido tomar su pulso o su presión arterial hoy?
No tengo monitor de presión en casa.
No, I don't have a monitor at home.
Could you come to the clinic today to check your blood pressure and to talk to the doctor?
¿Puede venir el día de hoy para chequear su presión y para hablar con el doctor?
Sí, puedo ir esta tarde.
Yes, I can go today in the afternoon.
How about 2:30?
¿Qué le parece a las 2:30?
Me parece perfecto.
I think that would work.
Good, we'll see you then.
Okay, lo vemos entonces.
All right, good. That's it for that scenario. We do have still a little bit more time, so give me just a minute. We can start the next scenario, vertigo and dizziness.
Okay.
So, hello and welcome. My name is Erica. I will be your physical therapist.
Hola, bienvenido. Mi nombre es Erika y voy a ser su terapista físico.
Okay. I read in your chart that you have experienced dizziness. Could you explain a little more?
Miré en su interpreter needs to look up a word.
Sure. Okay, so I can give you the spelling. Well, I'm sure you don't need the spelling, but there it is. Anyway.
Yeah.
And Michaela has a very good suggestion for you.
Yes.
Right.
Can interpreter needs repetition?
Sure. I read in your chart that you have experienced the dizziness. Could you explain a little more?
Miré en su expediente que ha experimentado mareos. ¿Puede explicar un poquito más?
Okay, good. Good job, Linda. Especially for your first time, that was great.
Thank you.
All right, you're welcome. And let me see. We also, Anna, you were one of the first ones to log in. We haven't done you yet. Are you ready to give it a try?
Yeah, I will give it a try.
Okay, good. So let's continue here. All right, so the doctor just asked for some more explanation, and she says, pues este pasó de repente hace aproximadamente 2 semanas.
Well, this happened about 2 weeks ago.
Me desperté por la noche y cuando me volteé fue cuando sentí los mareos.
I woke up at night, and when I turned around, I felt the dizziness.
Okay, good. I just realized you left one word out that was could have been important to a diagnosis in the one before. Sorry, I just caught it after we started the next one. But the first sentence, it was, pues esto pasó de repente, hace
Right.
aproximadamente 2 semanas.
Okay. This happened certainly about 2 weeks ago.
Okay, good. All right, so now she continues. Sentía como si el mundo estuviera dando vueltas.
I felt like the world was. Okay, I need to look up for a word.
Sure. Michael is helping you out in the chat box there.
Okay. Hanging around, spinning.
Okay, so spinning would be a good
Spinning.
way to say that. Yeah.
Okay.
Okay. Now you said hanging around. Are you using Google Translate?
No, I'm using reversal.
Okay. All right. So if you look at the context, reverso is very good too. It's like Lingui. They give you context. If you look at the context, dando vueltas, you could also use it as hanging around, but in a whole different context.
Okay.
So that's why it's important to look at the context before we use a word. But so in this case, spinning is the perfect way to say it. So, all right. Intenté levantarme de la cama.
I try to stand up from the bed
Porque tenía ganas de vomitar.
because I wanted to give me a second. I need to look up for that word too.
Sure. There's
Vomit.
Okay, good. Yes, those are the hardest words sometimes because we think we're speaking Spanglish, maybe, right, when it's that similar.
Yeah.
But good. All right, and she continues. Y por poco me caigo.
And I was close to fall.
Afortunadamente no me caí y llegué al baño a tiempo.
Fortunately, I didn't fall, and I go to the bathroom quick.
Okay. Right. I'm sorry to hear that. It must have been an uncomfortable experience.
Siento mucho escuchar eso. Fue una experiencia no muy confortable.
Is this the first time it has happened to you?
Esta es la primera vez que le sucede eso.
Nunca me había pasado antes.
I never had experienced that before.
Okay, good. Good job, Anna. Very good, especially again for your first time. So you'll see it starts to get more comfortable as it goes along for you, but good job.
Okay, thank you.
Yeah, you're welcome. Next we have Esther. Hello, Esther. How are you?
Hello, I'm good. And you?
Okay, good, thanks. Right, we can continue here and then we can finish with some site translation. Let me see. So now the doctor asks, have you had another incident of dizziness since that time?
Avez-vous déjà eu un autre incident de vertige depuis là?
Yes, unfortunately, it happened to me twice after the first time.
Oui, malheureusement, ça m'a déjà passé 2 fois après l'incident.
And both times I had to sit down on the floor so I wouldn't fall.
Et les deux fois, j'ai dû m'asseoir par terre.
Okay. So then she ended, so I wouldn't fall.
And can you repeat? Interpreter need the repetition for the last part.
Sure. And both times I had to sit down on the floor so I wouldn't fall.
Et les deux fois, j'ai dû m'asseoir par terre pour ne pas tomber.
And have you fallen in this last year?
Étiez-vous tombé la dernière fois? Non, last year?
Yes, so in the last year. So they could also say in the last 12 months.
Oh, la dernière année. Last year, yes.
Good.
Last
Okay.
year.
No, thank God I have not.
Non, grâce à Dieu, j'étais pas tombée.
I try to stay in good shape so I don't get weak.
Interpreter need repetition.
Sure. I try to stay in good shape so I don't get weak.
J'essaie de me tenir en forme, mais j'étais faible.
And so that I don't fall down like I see happening to my friends.
Interpreter need repetition again, please.
Okay, sure. And so that I don't fall down like I see happening to my friends.
Et pour ne pas tomber comme je vois arriver mon ami.
Some of my friends have broken their hips.
Un de mes amis était tombé et a rompu leg.
Okay,
The last
so
word?
the hips. I
Hip.
can give you the
C'est
spelling.
l'hanche, hanche.
Okay. Good.
Et a rompu sa
Okay.
hanche.
Okay, good. I also have osteoporosis.
J'ai toujours eu breast.
Okay, I'll put that in the chat box for you. So osteoporosis.
Osteoporosis, sorry.
Oh, good. And my doctor told me how important it is not to fall.
Et mon docteur m'a toujours dit que c'est important de ne pas tomber
So that I don't break my hip as well.
et de ne pas briser ma hanche comme d'habitude.
Okay, good. All right, give me just a minute to open up. Let me see, so we can do some site translation. And I don't believe we had started this with you yet, so we can start the beginning. I'll give you the title. This is the title of an informational brochure on giving injections. So go ahead and take a look, and whenever you're ready.
Administrate some medication by injection on the skin.
Okay, good. And let me see, I'll give you the first sentence here. Just a second. Sometimes it doesn't copyright. Give me just a second. All right, there you go.
This is some basic instruction on how administrate the medication by injection on the skin.
All right, good.
And called injection on. Let me look up for it.
Okay, sure. It's very similar in English.
Injection kitten.
And we're actually at the end of the time is up, so I can give that for you here. So it's very similar. It's
The injection
subcutaneous.
or skin.
Okay, good. So
Subcutaneous. Yes.
yeah.
Thank you.
Okay. All right.
Subcutaneous. Yes.
Yeah.
Thank you.
Okay. All right. Good. Good job, Esther.
Thank you.
And, you're welcome. And good. So that concludes. I think everybody's had a chance to go. If anybody has any questions.